I think we learned this especially from COVID-19. People got a better consciousness of being aware of others. So if you're sick, what?
Stay home.
Welcome to the Southwest Utah Health Podcast. For the nearly 300,000 people living in the region, public health is the ounce of prevention that's worth a pound of cure.
I'm here with Peter, one of our epidemiologists, and it's getting a little foggy inside this suit, and so I'm going to take the headpiece off. If this were a real emergency or I needed to wear this, it would actually have a motor with some airflow, right? Where I'd be able to breathe a little bit better. Well, the reason Peter's here with us today is because we want to talk about how to prevent getting sick. Infection prevention, avoiding germs, especially during this part of the year. Every year we have a cold and flu season that starts in the fall, peaks in early spring, maybe February, and then kind of peters out during the summer. You can start by saying, first of all, why would someone need to wear a getup like this, where it looks like with the gown and the gloves and this, I'm completely sealed off from outside air?
They call it a PAPR. It's mainly for airborne precaution agents. So we have measles, we have anthrax, smallpox, the kind of things that would transmit typically through the air.
And it also feels like this wouldn't be something you'd wear long-term, like all day, right? Is this for a certain period of time that you have close contact with maybe people that are infectious?
Yeah, it would be exactly what you're saying. It'd be with a person who is either has it or suspected to have it, you'd wear that as a precaution.
Now, a lot of people during the COVID-19 pandemic were maybe unsure about what type of disease it was, even though I think we were pretty aware with coronaviruses. A lot of times they're droplet spread. Maybe there's some controversy or things we don't know yet about how airborne it was. Were people wearing these sometimes in the hospitals treating COVID-19 patients?
Yes, so the medical providers would wear this to protect themselves from COVID-19, because COVID-19, as you mentioned, is a droplet precaution, but it also would be airborne as well.
Okay, so both droplet and airborne, at least for a period of time, right?
Yes.
Okay. What would the type of disease pop up that could possibly emerge in southwestern Utah that you would be concerned about that would require gear like this for medical professionals?
So we're looking at maybe an anthrax terrorist, bioterrorist act, or a epidemic of measles in our area may warrant that as well.
But I don't think, when's the last time we had a measles case? Even in Utah or in the United States? Do we see a couple every year?
We still see a couple every year. This past year, 2024, we did see an increase in measles, not particularly in our area, but in Florida, in Illinois, they had kind of an epidemic in certain communities of outbreak of measles, but not in Utah itself.
When measles comes in, that disease, it seems like I've heard that it's not erupting, the source isn't in the United States, but it's travel acquired. So people might travel to another country where people maybe don't have that immunization, pick up measles, bring it back, then it tends to spread amongst unvaccinated populations. Is that the typical pattern?
Yeah, you're right. Yeah.
So we've talked about measles, which before working for the health department, I didn't realize was airborne. It floats in the air for quite a period of time. And our director, Dr. David Blodgett, mentioned it's the type of thing where you could walk through a room, and if you were infected and I walked through this room, there's a good chance I might pick it up. It's that virulent.
Yes. It's very contagious. COVID-19 was, just for an example, a comparison, it would be, within a room for 15 minutes within close contact. That was kind of the standard. But for measles, it's much more contagious. And so, just as you're saying, just if I was to just put my head into the room, breathe in, cough into the room, everyone would be at risk of contracting measles who are not vaccinated.
Right. Now we talk about these contagious diseases and vaccines. As far as public health interventions go, there's been a lot of things in humankind that have advanced us and helped us live longer and healthier lives. But immunizations have been a remarkable technology that, my understanding, of exposing yourself to a degree of the disease to get immunization from it has been around maybe in centuries. I've heard that China practiced a form of that. As far as the Western world, we really saw it get ground just in the past 100 years with the development of polio vaccine, measles vaccine. Now we have a lot of different vaccines against diseases, but they're diseases we don't really hear about much anymore in the United States. I think in the generations before, most people either themselves or were related to or had a loved one that either had that disease or was disabled or even died from it when we talk about those type of things. And so again, measles, not something we really see happen a lot in the United States. In fact, we've gotten rid of, I think smallpox has been completely eradicated because of public health measures and vaccinations. Polio, we're almost there, right?
Yes.
Where is it still endemic in the world?
We have just a lot of the Asian and kind of African areas where it's still endemic in those areas.
All right, so let's get down to the basics first of all. When it comes to diseases, what is a germ? Where do diseases come from? How do we get them?
And so a germ is a small living organism. It either be a bacteria, virus, fungi, protozoa. These kind of things live in our environment, and some can be good for us. Let's say inside of our gut, we have good bacteria. We want those things, but some of these germs can cause us to have illnesses. And so my role as an epidemiologist is to kind of prevent the spread of these contagions, these germs. Yes.
So we're here living our normal life, going to work, going to school in our homes. How does that bacteria or virus get into our bodies and infect us?
A lot of times it'll be from our hands. We touch our eyes, our nose, our mouth, or from our food that we eat. And it could also be from the air that we breathe. And it could even just be on our skin, getting through our skin.
When it's cold and flu season, what are those diseases? I'm imagining they're mostly respiratory, right?
Yes,
Meaning they affect our head cold or in our chest, our
Yes.
breathing system. So what kind of bugs would that include?
Yeah, so those germs would be in the influenza or flu or in COVID-19 or other cold viruses. It could be RSV. These are the kind of things that we see, as it peaks during our winter months here in the northern hemisphere. We see an increase of these germs that come and make us sick.
What about pneumonia? You hear about different types of
Yeah.
pneumonia. Walking pneumonia can especially be rough on little kids.
Yes. And all these influenza, COVID-19, RSV are all respiratory viruses. And so once that gets into our system and kind of settles in there, then we have this pneumonia and we have built up fluid inside of our lungs. And so some people, as you mentioned, have walking pneumonia where they're actually still sick and still starting to have a drain on their system, but they don't know it yet. Something to keep an eye out for the kids. If you see them not being as active as they were before or any change in behaviors, you may want to consider taking them to your primary care provider.
We had that happen in my family. My oldest son was probably maybe 6 or 7, was a really active kid, but just seemed to have, like you said, a drain on his system, seemed tired, his color was off. We finally took him to the doctor, and they checked his oxygen, did a lung x-ray, and said, he's got walking pneumonia. Basically, you're walking around with pneumonia. You
Yes.
don't know how sick you are. And he had to have, I think, breathing treatments. Respiratory therapist took a look at him, and it took probably 3 or 4 weeks before he recovered. And again, it seemed different than another illness. It wasn't going away, and his energy was kind of low. So I'm grateful we have the medical interventions that we do. I guess the big danger of pneumonia is what? Getting to the point where it's life endangering?
As you mentioned, his oxygen saturation was decreasing, and so once we have decreased oxygen saturation, other functions of our body start to decrease as well. Either the brain function or muscle function, all these different systems, they need that oxygen. And if we don't supply it, then we could damage it.
Yeah. A lot of these respiratory diseases, if you are a teenager up into young adult, middle adulthood, you have a strong immune system, you can fight these things off, recover at home with rest and over-the-counter medications, drinking lots of fluids. But it's the vulnerable populations that really take the brunt, right? Small children, older people, pregnant women. If you've got a chronic disease of some kind, especially lung disease, diabetes, those types of things, you can end up in the hospital and even be part of the statistic where in the United States, I think we've got influenza and its related illnesses like turning into pneumonia in the top 10 causes of death.
Yes.
And in the past couple of years, COVID-19 has entered the top 10 causes of death, right?
And just recently, but now we've seen a decrease in COVID-19 as a leading cause of death. So that's a great great news, yeah.
So we know about the dangers and risks of disease, what we can do about them, where they come from. But as far as not getting it in the first place, you mentioned before, if we're out and about and we touch a hard surface or we touch a person maybe, or get contaminants or germs on our hands, then we touch our face, eyes, nose, or mouth. That's how it gets into our body, right? You've got a little setup here, and I think we're going to talk about probably one of the best ways, if not arguably the best way, to keep from getting sick. So tell us about this.
Yes, and so as you mentioned, during this season, there's these respiratory viruses, and the main vector of transmission is through droplets or touching, as you mentioned, touching surfaces, then touching your mouth or nose or eyes. And so the main strategy to prevent is washing your hands. And so we're going to talk a little bit, we're going to demonstrate. We want to wash our hands before we prepare food or before we eat, when we go into the restroom, when we exit the restroom, take out the garbage, or interact with our pets. Or if we get our hands dirty, we want to wash them off. And so you need water. It can be warm or it can be cold. We'll get some soap here. What soap does, and soap gets that oil and grime off your hands, which the germs can attach to, and so they're really attracted to, and they get into it. Also, the the soap will take the germs off of your own skin, okay? And so that's what these bubbles are for. And so the water's great, and the lathering's great. The most important, how long you do it, the most important part is to get those bubbles going so it activates and grabs those germs, and we can wash them off your hand. So we want to go between the fingers, underneath the fingernails, in the backs of our hands. And if you want to sing a song, you can sing Happy Birthday twice, or ABC, or something like that to keep the time. And then
I've been counting. It's been almost 30 seconds.
All right,
now,
there we go.
It's
So
pretty thorough.
we're nice and got some bubbles here. So we'll go and get that, wash it thoroughly off, and then want to dry it off. And if it's a manual sink where the water comes off, want to grab another one off, turn it off, okay? So we don't recontaminate our hands that we just washed.
So you mentioned the times to wash your hands. I think that would also include if you've been out and about in public. Now, what if people say, well, I can't get to a sink with soap and water? What about hand sanitizer?
Yeah, so if this is not available, this is the best option. The second best option would be using that hand sanitizer. Kind of doing the same kind of thing. We want to just kind of rub it in our hands about 20 seconds. The way that the alcohol typically works, we want it to dry off. Don't put it on and then use a towel to wipe it off. You want that chemical process to work, so that alcohol will dry and then kill the germs that are on your skin.
So let the hand sanitizer air dry.
Yes.
So we're doing all these things to do all we can to wash our hands and to, I've even heard some nurses say, try to keep your hands away from your face during cold and flu season. That's hard for people to do. But what if you're doing all of that and someone comes up and sneezes in your face, or they're coughing in that 3 to 6 foot zone where those droplets can be inhaled by you?
Yes.
I think we learned this especially from COVID-19. People got a better consciousness of being aware of others. So if you're sick, what?
Stay home. If you're sick, stay home. Let's say if someone else in your household is sick, should you stay home? You should go about your normal day until you're sick, then you stay home.
Well, we appreciate it, Peter, giving us the basics on germs, where they come from, what we do about them, a reminder on the good old-fashioned techniques of hand washing. Hand sanitizer is a good second place if you can't get to it. Stay home if you're sick. Don't be a hero, right?
Yes.
And we really appreciate your knowledge and all you do for the health department and for our community.
This podcast was brought to you by the Southwest Utah Public Health Department. For more information, visit swuhealth.gov.